Thank you, Deputy McKenzie, and thanks, honourable senators. What we've achieved in Nova Scotia is almost against the technology and the equipment that we use in health today. We've done that, which the bill speaks to, based on establishing data standards that are international standards, not Nova Scotian, not Canadian, international. And I think that's really key as we think about this journey as we go forward. Um, Let me make a comment that would resonate, I think, with everybody. The financial industry is global, and we've all moved our finances around a global economy for decades now. Anytime, any place, anywhere, and Canadians we must do better. Canadians demand better, and health's no different. What we've been able to achieve in Nova Scotia, Deputy McKenzie talked about, and we are the only jurisdiction in Canada and one of the rare in North America to do this, is to bring all aspects of a health record from all aspects of the health system centered around the citizen. Most jurisdictions have a hospital record or a jurisdiction of hospitals. We have brought primary care, pharmacy, virtual hospitals together. So we've really achieved interoperability in Nova Scotia. This bill still is something where we need in Canada. And to speak for that is we've had to do that with various technologies, and we've had to do a heavy lift to use established data standards that are international and do the lift to map data. Tracy talked about how we map data across language. Well, even the mapping data technically from vendor system X to vendor system Y is a heavy lift and a heavy effort. What this bill would enable us
Thank
to
you,
do.
Miss.
Thank you so much. One comment on that, because I agree with you wholeheartedly, that as we roll this out, as we put the regulations in place, as we adopt standards in Canada, and I say that intentionally, not Canadian standards in Canada, I think it's really imperative that we align to international health standards. For that exact reason, some of the vendors in Canada are Canadian, many are global. And we think about the big ones, Meditech, Oracle, Epic, they're global. And we think about the market. And that's why we did this in Nova Scotia. Nova Scotia doesn't have the market to drive the vendor. Canada, is a market globally, but it's not the US or Europe. So, as Nova Scotia adopted one of our standards, Fire R4, which is an international standard, 6 months later, the US went there, and later on, the Europe went there. Felt pretty confident we're going to be good. And we need to be strategic like that for that exact purpose. Vendors are going to drive their product to what the market so they can sell. So, Canada's standards need to align to international, because that is the market. Absolutely, this is a global issue. Everyone uses different technology, but I'd mention the U.S. has made some progress, and they declared nationally that one standard, which is international fast interoperable healthcare resources called FHIR, would be their standard. Europe followed after that, so they get exchanged because Europeans go across countries and citizens. So really shortly, a quick answer: like Denmark is looked at globally as one of the leaders in exchanging health data, is struggling with that today because they've done it based on a Denmark standard, not on an international standard. So they're struggling to exchange with other Europeans, become compliant with that European legislation. So as we move across this great country, Canada, we need to consider that, making sure we're aligning, because Canadians get care in their communities, Canadians get care in their provinces, Canadians get care across the country. Canadians also go elsewhere to get care.